Well, we, in our detoxification process, so we have 16 licensed detox beds. So clients that come in that are on the opiate protocol, so they're dependent on heroin, that's their primary diagnosis, or some other opioid, would receive what's actually called Subutex. So Subutex is buprenorphine without the naloxone. Suboxone is buprenorphine with the naloxone. So, the Subutex is the protocol that we use here over a 5 to 7 day period. Suboxone is what you find typically in the medication-assisted treatment programs that you see at various outpatient treatment centers and sites, and even some physician offices also offer Suboxone. Vivitrol is a shot. Basically, the same type of buprenorphine lasts over a period of a month, so you're not doing daily strips or dosing of Suboxone like Suboxone. You're doing it's a month, over a month period of time. So you have to go every month. Now, typically, and if it's done correctly, the Suboxone is in concert with treatment modalities. So, someone that's just using Suboxone as a medication to treat opioid dependence is not going to have a very good outcome, because what that medication is meant to do is treat the withdrawal symptoms and the cravings and urges while you're working on the behavioral changes that are necessary to lead a life where it's easier not to use. Well, yes. I mean, the naloxone is going to block the euphoric effect if someone does use it, but it also is going to throw them into the withdrawal process. So, we've chosen to use the Subutex, which is the pure buprenorphine. It seems to be a fairly comfortable detox for the client. But, there are clients that haven't responded to total abstinence. And I guess, when you called to ask about the difference, First Step Recovery is committed to achieving and sustaining recovery. I mean, that's the goal, is not just to achieve it, but to sustain it over a lifetime. But what we have recognized, we've been open for almost a year, and we have treated now almost over 1,000, I think it's 1,100 actually, patients. And sitting and staffing on a daily basis and seeing that some of the same people are coming through multiple times, it makes you stop and pause. What is the therapeutic value of 4 times in 4 months? So are we serving that patient to the best of our ability, or is there another type of treatment that might work better for them, given their unique set of circumstances? So when we take a look at a patient, we have to take a look at, not only what they're using, but how long they've been using, what is their risk factors, what are their protective factors, what is their recovery capital, because perhaps their road to recovery is not going to be the same as the next patient that comes through the door. Well, I think that, there's probably several schools of thoughts about recovery. I mean, the 12 steps of recovery is based in AA, Alcoholics Anonymous, and then of course Narcotics Anonymous adopted that. And every support group that you see in every type of, whether it's Overeaters Anonymous or Gamblers Anonymous, is all based on the 12 spiritual principles. And out of the gate, that was the program, I guess, that was adopted as our philosophy, and we continue to utilize those principles in all of the treatment that we do. However, what we have seen over the course of the year is that while total abstinence is the goal and change is the goal, change in the way a person thinks, we want to move them through the stages of change and motivate them to embrace total abstinence. People are dying in the meantime. And what do we do about that? So, that's been something that has just recently evolved, because we can't apply a cookie cutter approach. And if someone is resistant to total abstinence, we need to take a look at that patient and what are the reservations, what is the resistance. And just like any other chronic disease process, there's a certain amount of compliance issues that goes along with managing a chronic disease like diabetes or hypertension. Some things can be managed through lifestyle changes, and some require an alternate course of treatment or medication. And so we just want to keep people alive. The war, as we see it, is with the disease of addiction, and it's not about my treatment is better than your treatment, as long as it's done properly. And the goal is to use that medication as a short-term vehicle towards total abstinence. We support that. I mean, we're not in. We don't see that as a necessary negative thing, but we want to provide options to the road to recovery and honor all paths leading that way. I think within the rooms of AA and NA and the other sober support, I know that there's a prevailing philosophy that total abstinence should always be the goal. But what's one person's idea of recovery might be different than another person's recovery. So should it always be the goal? It should be a situation where the client is functioning, they're healthy, they're contributing to society, they have a job, they have healthy relationships, and how that person achieves that, I mean, that's going to be very unique to each person. I mean, the fact that a person has the disease of addiction doesn't absolve them from the responsibility. So of complying with the rules of society. So, getting behind the wheel of a car when you know that you're under the influence is just clearly, it's not acceptable on any level. No one, knows when they get behind the wheel of a car that they're going to have a heart attack. So, I think that the person is responsible to seek the help, for their disease. I think the distinction lies in that we're all accountable for our actions. Even if we're dealing with a disease process, it's our responsibility to take the steps. And sometimes it requires intervention, that's for sure, because typically it's those types of situations that is going to thrust someone into change, hitting their bottom or experiencing a major consequence, because it's difficult to stop doing something once it's reached that compulsive, obsessive level as addiction does. I mean, the first step is for the person not only to admit, but to accept that using that substance or that drug has created both internal unmanageability, meaning that their emotions are unmanageable, how they feel about themselves is unmanageable, and also external unmanageability, meaning that they're receiving consequences for their actions and for the choices that they make. So, that's the first step as it relates to personal responsibility. That's a long journey. I mean, the whole 12 steps is about taking on responsibility for actions. When you're at that point of the first step, you're at least recognizing that something has to change, and that you can no longer deny the fact that whatever it is that, that substance or that behavior is causing great internal and external problems for you.